ECG. Today we are going to learn about an ECG. What is an ECG? It is an electrocardiogram, the graphical representation of the electrical impulses of the heart. So with these basic 10 steps, today we are going to learn how to interpret an ECG. They are rhythm, rate, axis, P wave and PR interval, Q wave, QRS complex, QT interval and ST segment and T wave. So here comes the first step, that is rhythm. How to interpret a rhythm in an ECG? To look at that, we first look into that normal PQRST waves. Here comes the P wave and it is the QRS complex and T wave. For a normal sinus rhythm, every P wave is preceded by a QRS complex and followed by a T wave with a regular RR interval. Then we will say it is a normal sinus rhythm. Here, look at the gap between two QRS complex intervals. It is regular here and followed by a P wave. Here we look at the both QRS complex. The interval between the two QRS complex is regular and it is preceded by a P wave and followed by a T wave. So that we say it is a normal sinus rhythm. So we come to the irregular rhythm. The first thing in the irregular rhythms, it is irregularly irregular. When we see the both QRS complex, the gap between the two QRS complex, it is 2 boxes and here it is almost 3 boxes and here it is almost 4 boxes. See, the two QRS complexes having only 2 boxes of interval and here we can see there is 3 boxes of interval and here we can see 4 boxes of interval. So the gap between the two QRS complexes interval is not regular, it is irregular. So we can say it as a irregularly irregular rhythm. So when we come to the irregularly irregular rhythm, here we can see the interval between the two QRS complexes is 3 boxes and here it is 2 boxes and here it is again 3 boxes and again it is 2 boxes. So it is following a regular pattern in the irregularity. So we can say it is a irregularly irregular rhythm. Irregularly irregular type of rhythm we can see in cases of atrial fibrillation, and regularly irregular type of rhythm we can see in second degree type of heart. To calculate an heart rate from an ECG strip, first we have to know the rhythm. So whether the rhythm is regular or irregular, based on that we can calculate a heart rate. So when the rhythm is regular, we can calculate the heart rate by using this formula, that is 300 by number of big boxes between two RR intervals. Here we can check it is a regular rhythm, so we can expect there is 4 big boxes between 2 RR intervals. So 300 by 4, we get 75 beats per minute. This is the heart rate how we can calculate for a regular rhythm. And when we come to the irregular rhythm, we should not follow this 300 by formula because the RR intervals are varies in each step. So for this we have to follow this formula. Number of R waves in 6 seconds into 10, because in 6 seconds in 10 we get 60 seconds, that is 1 minute. Usually we calculate the heart rate for 1 minute. Whether it is irregularly irregular or regularly irregular, we use this formula, number of R waves in 6 seconds into 10. So we can see here the number of R waves, there are 1, 2, 3 and 4 in 6 seconds. If we imagine 4 into 10, so we get 40 beats per minute. So this is how we can calculate heart rate from an ECG strip using along with the rhythm. Here comes our third step, that is axis. How to interpret an axis deviation in ECG strip. So for that we have to look at 2 leads, that is lead 1 and an AVF. AVF is an augmented vector put. So for an axis deviation we have to look only these 2 leads, lead 1 and AVF. For that we need the QRS complex. If the QRS complex is positive in both lead 1 and AVF, then that strip we can say it as a normal axis. When the QRS complex is positive in lead 1 and negative in AVF, then we say it is a left axis deviation. And when the QRS complex is negative in lead 1 and positive in AVF, then we will say it as a right axis deviation. For easy, we will remember it with a mnemonic, that is right axis deviation, that is right returns. When the QRS complex is negative in lead 1 but it is positive in AVF, that is it returns to to the upside, that is right returns, that is right axis deviation, and when the left axis deviation, left leads, it is positive in lead 1 but it is negative in AVF. So that we can remember it by left axis deviation. So now we are going to interpret a P wave in an ECG strip. So this is here we can see this is a normal P wave, and the P wave abnormalities are if the P wave is narrow and peaked, it is known as P pulmonal, and this condition is seen in right atrial enlargement, and when the P wave is wide and notch in between, it is known as P mitral. The M shape here resembles the wide and notch shape resembles M alphabet, and so that we can remember it as a P mitral, and it indicates the condition of left atrial enlargement, so that we can interpret whether there is right atrial enlargement or left atrial enlargement with the help of P wave. The next step in the ECG is PR interval. Here the normal PR interval between the P and QRS complex is 3 to 5 small boxes. So then we can interpret it as a normal PR interval. When the P and QRS complex is prolonged, that is the PR interval is prolonged, it is seen in the condition of AV blocks, and when the PR interval is reduced, it is seen in the condition like WPW syndrome, and when the PR interval is depressed, here we can see that interval is depressed, so it is seen in the conditions like pericarditis. Here comes our next step, that is Q wave. Generally we see the Q wave in lead 2, lead 3 and AVF. So here comes the normal Q wave, and here we can see the Q wave is depressed. So the depressed Q wave, that is pathological. Q wave becomes pathological when it is deep more than 2 small squares, and it indicates that maybe there is a current MI or an old MI. So the next is QRS complex. The normal width of a QRS complex is 2 to 3 small boxes. When the QRS complex is broad or wide, so that indicates it has ventricular arrhythmias, and they may be ventricular ectopic, ventricular tachycardia or ventricular fibrillation. There is wide QRS complex, that is more than 3 small boxes, so that indicates ventricular arrhythmia. So next is QT interval. Here we can see the normal QT interval, and here we can see the abnormal QT interval. Here the QT interval is prolonged. So the prolonged QT interval indicates also ventricular arrhythmias in the ECG strip. Here comes the most important part of the ECG, that is the ST segment. Generally the ST segment is from S wave and to the T wave. Here the ST segment is normal, and here we can see the ST segment is elevated from the isoelectric line. So this is we say as isoelectric line or a baseline. When the ST segment is raised or elevated from the baseline, so that we can say it as a ST elevation. It is seen in the conditions like acute myocardial infarction or pericarditis. And in the second thing we see there is depressed ST segment, that is it is depressed than the base or isoelectric line. It is seen in the conditions like non-ST elevated MI, myocardial ischemia and posterior MI. So that we can interpret the myocardial infarction with the help of the ST segment in the ECG strip. So let's come to the last part of the ECG, that is T wave. T wave is generally upright in all leads except AVR and V wave. V1. Generally we see here it is a normal ECG, so the T wave is like this, and the abnormalities of T wave are like maybe it is long and narrow. Here we can see the T wave long and narrow. It is seen in the conditions like hyperkalemia, and it may be wide, that is hyperacute. Hyperacute T wave is seen in the conditions like LEST-MI, ST elevated MI conditions. And when here comes the depressed T wave, it is depressed from the isoelectric line, and so it is known as a depressed T wave. Depressed T wave is seen in the conditions like myocardial ischemia, ventricular atrophy and hypokalemia.